I often get asked if Medicare covers hospice and home health care. And I love when I get an easy answer. And the answer is yes. And you know it's coming. You know it's coming. The qualifier, and that is usually, sometimes, right? Let's start with home health care. If you're envisioning home health care in lieu of long-term care, kind of somebody that needs long-term care, not to use that term, but the care they need is long, and they'd like to get it in their home, no. Medicare Part A, hospital insurance, will cover home health care. It'll send you an aid once a week, but you have to have the expectation that it's going to be short-term, okay? So that it's something that you could recover from. And you need some kind of skilled care, such as occupational therapy, physical therapy, wound care, something. They're not just gonna come out and help you get dressed, go to the bathroom, take your medicine. That's what a lot of people think. Like, my mom just needs a little help, showering and getting dressed. No, they're not gonna do that. But if you have Medicare, then you have Medicare Part A. Remember, that's the chassis that Medicare is built around. Part A and Part B is original Medicare. You have Part A, then you are entitled to some home health care. Now, if you would like more than what original Medicare provides, many Medicare Advantage insurance plans that you would buy to supplement your original Medicare, many Medicare Advantage plans, you might know them as HMOs, PPOs, they have a more robust offering for their home health care. So that's something that you should look into as well. Hospice is end-of-life care when your doctor determines that you are unlikely to survive, and hospice is covered 100%. And that's the doctor, the nurses, the aides, the medication. That's all, again, all covered under Medicare Part A. So my answer on this week is pretty easy. Yes, Medicare does pay for hospice. You won't pay anything. And Medicare does pay, under certain situations, for limited home health care. If you have more questions, ask me down below in the comments. I would humbly request you to subscribe if you haven't already. Consider it. And call us. Call my family. We're here to help you when you have questions. I know many of you are not the person on Medicare out there, but you're the family members. And you are trying to navigate this crazy web, trying to help your mom, sister, aunt. Call us. Talking to us is free. Our experts are here to try to help you, get through this. Thanks for tuning in.